Hello, my name is Sarika Devan, speaking on behalf of UNODC INEHI Centre of Excellence, and I'm here today with Dr. Howard Kress. Thank you very much for joining us.
Oh, you're quite welcome.
Dr. Howard Kress is the leader of the implementation of the Violence Against Children surveys of the US Centre for Disease Control and Prevention.
Correct, thank you.
And it's a pleasure that you are joining us here today. I'm just going to ask you a couple of questions about your research. So my first question is, what type of violence against children have you measured?
Sure. So the Violence Against Children surveys, or as we call them, the VACs, are national household surveys designed to get the prevalence of multiple forms of violence. These surveys are requested by national governments and are supported by U.S. Centers for Disease Control and Prevention, USAID, and a group called Together for Girls. National governments request the survey, and CDC provides technical assistance to those countries when they request the survey. In terms of what sort of violence we collect information on, we get the lifetime prevalence rate of physical, sexual, and emotional violence. We interview 13 to 24-year-olds for the survey, and we then collect information on the most recent occurrence of violence, the first time violence, and if that violence happened within the last 12 months. We also collect information on other health outcomes such as risk for smoking or suicide ideation.
Very interesting.
Thank you.
So what are the challenges in approaching children as a target population?
Sure. So first, it's really important to get child victims to respond to the survey because they have the most relevant information for understanding violence against children. However, at the same time, we need to make sure that we're providing as many protections as we can. And one way we do that is through having a multi-step consent and assent process, which clearly spells out to the children and to our other respondents what sort of questions they're going to receive. At the same time, we also work with the national governments to produce a referral and response plan for any respondent who may or may not, encounter problems during the interview. Part of this referral plan gets them linked up with referral services and support services. Last but not least, we also make sure that all the survey protocols are cleared by local ethics review boards. So we do a lot of things to protect our respondents due to the nature of the survey.
And it would be very interesting to know whether longitudinal studies have also been done that link a child being a victim early on in life and actually then engaging in criminal activity later on in life.
Sure. So we have a few examples of that I can talk about. I think the best example is we recently completed some analyses of data from Malawi where we looked at 19 to 24-year-old males and their perpetration of intimate partner violence. And we found that those males who experience childhood violence are much more likely to commit intimate partner violence than those males who did not experience childhood violence. Likewise, even though this is in criminal behavior, it is an exposure, is we can see that children and respondents who experience childhood violence as young adults are much more likely to have feelings of depression and contemplate suicide.
The last question that I have is, according to your research, what prevention and protection factors have you identified in children?
Thank you so much for asking that question. One of the things we've done within the Violence Against Children survey work is work with multiple agencies around the world, including other UN agencies like UNODC, UNICEF, as well as US government agencies and WHO to produce a technical package called Inspire, 7 Strategies for Ending Violence Against Children. This package is a suite of the best of the evidence-based programs and policies for reducing and or eliminating violence against children in low and middle income countries. In order to help countries understand how to implement Inspire, CDC actually conducts what we call a data to action workshop, where we link the VACs data to the Inspire strategies and help governments create a response plan which would then be costed and funded within the government's own budgets. Last but not least, we also work with the host governments to publish the VACs results so that everybody within the country knows how much violence against children there is within that particular country.
Thank you very much. It's very interesting to speak to you, and thank you for answering all of my questions. And I wish you all the best for the rest of the conference.
Thank you so much for having me today.